you all are joining us in this online format. And we're also incredibly grateful to Dr. Rotneck for offering to do this webinar for us. It was a little bit late notice because our original in-person speaker that we had scheduled is actually a county Department of Public Health employee, and as you can imagine, they are all a bit occupied at the moment. So we really appreciate Dr. Rotnick stepping in. And again, I want to encourage anyone, if they have any questions, to use the webinar chat panel. I will try to address those as best as possible. And for those of you who are tuning in to receive contact hours, I will step in at the end of the presentation and provide some information on how you can submit payment and get your certificates for those. So again, we will cover that. We'll just cover it at the end of the presentation. So unless there are any other questions, which I don't think there are, I'm going to go ahead and turn it over to Dr. Rotnick.
Okay, thank you so much, Stacy. I'm just waving to say hello to everybody, but I will turn off the video because my cats have an innate sense of Zoom bombing every presentation I'm in. It's a pleasure to be here today with all of you because working with Stacy and her team at NCADA, I've really enjoyed finding new and effective ways to collaborate from my role at St. Louis U, also as my role as medical director at Assisted Recovery Centers of America, also working with the Archway Institute. There's a lot of great ways that we're working together moving forward. So today's topic, I would like us to kind of step back a little bit and reflect on what we're seeing right now at my clinical site, which is ARCA. And we've been noticing in the past few weeks a large increase in the number of people coming in or calling too for alcohol addiction. And it got us all thinking, you know, what's going on right now in the community? And sitting down and talking with John Stuckey from Archway and Recovery House, and Philip Wanger, who is our clinical pharmacist at ARCA, we started talking about this idea of people substituting one addiction for another and then compounding it with some of the challenges we're seeing right now due to COVID. So I'd like us to take a look at that today. And then also at the end, Stacy or maybe other folks from NCADA are going to step in to talk about the programs that NCADA has in place, as well as resources and contacts, because that's their area of expertise, is the therapy, the prevention pieces, the interventions. So hopefully we'll do a 1-2 punch today to talk a little bit about addictions and changes we're seeing due to COVID-19. So if we take a look at our next slide, let me see here. Okay, Stacy, I don't know if I can forward my slides, even though I should be able to. There we go, thank you. We've all seen this chart or a version of this chart multiple times over the last few years. And it's important because, of course, it's tracking death rates from drug overdoses from 2000 in this chart to about 2016. We have known that the opioid epidemic is sucking all the air out of the room when we're talking about substance use disorders, in part because the immediacy of death that can result, especially from many of the new synthetic opioids. However, about 72,000 people died in 2016 from drug overdoses. In that same year, almost 90,000 people died from alcohol-related use, and over 480,000 people died from complications of tobacco. Excuse me. We haven't done a whole lot, though, with tobacco and alcohol in recent years. Now, however, the landscape is changing because of the enforced self-isolation of COVID. Next slide, please. There we go. Okay, let's take a look at a few pre-COVID numbers here. Um, Many of you on this call are probably already familiar with the National Survey on Drug Use and Health, which the federal government has been running for decades now, where they have, I want to say 65, 70,000 people surveyed every year to self-report around drug use, common behavioral health issues. And this has been an important way to kind of look at cohorts and changes in patterns over the years. This is from the most recent NSDUH report that came out earlier this calendar year, and it breaks down their alcohol, tobacco, and other use among the respondents, and then it's extrapolated to the country as a whole. But if you take a look, about 60% of people use some kind of psychoactive substances. By and far, the largest group are alcohol and tobacco. So let's take a look at the next slide, please. Pre-COVID, again, these go up to 2018. This is from our most recent report. And numbers have been pretty stable. Actually, if we look at the bottom graph with the in gray, and that's adolescents 12 to 17, numbers have actually been coming down among alcohol use. Of course, this doesn't include vaping and electronic cigarettes, which is my big concern with this age group right now and health consequences, but it shows that things have been pretty stable. So next slide, please. So now we're in this era of what is new, and this slide kind of shows how we've kind of have epidemic imposed upon epidemic with not only opioids and substance use disorders, we're also in a period where we're seeing great increase in suicide attempts and suicides. We're seeing then the COVID epidemic, which has the potential to make all this worse. And essentially that is because for public health efforts right now, the best tool that we have to spread down dissemination of COVID-19 infections is self-isolating or self-quarantining, where we minimize contact with others. Until we have a vaccine in place, that's really our best bet right now. Next slide, please. So with social isolation, where our real challenges come in right now is that we're not isolating at a time where everything else is going well. We have record unemployment rates, the worst that have ever been recorded since they've been followed. We have a lot of people who have been furloughed, who have been laid off, who are looking at financial insecurity, housing insecurity, food insecurity. We have a lot of young adults moving back home with their parents related to that. We have a lot of unexpected time with family and friends. We would like to think that is always good, but we know better. We know that many people are living together in what can be stressful or even in unsafe situations. There's been a lot of stories on National Public Radio recently around advocacy groups getting the word out about how to contact advocates in case you're in a situation with intimate partner violence, abuse and neglect, situations where a forced isolation can actually escalate violence or create problems with safety. The conversations I've been having with my colleagues in the addiction medicine field and our folks at Recovery House and Archway are the fact that opioid supplies are being affected with changes in social distancing, with more barriers from state to state, more barriers for people coming into the country. And all of that is really kind of disrupting the supply chain of opioids and other illicit substances, just like they're disrupting the supply chain of other products that we use on a regular basis. As a result, we have heard anecdotally, we've seen in publications that are not always on our radar, such as Vice and other magazines, showing that people who are usually the folks selling drugs are now hoarding their supplies, they're raising the prices, they're creating new problems with accessing product than we had before. On the other hand, the legal psychoactive substances, including alcohol, tobacco, and in many places cannabis, are skyrocketing. Just today, I came across another online publication that I get called The Conversation. Great resource. It's a lot of university authors who get together and brainstorm based on trends in culture. And they had an article today talking about the increase in sales in beer, wine, and liquor. And on average, liquor sales week to week have been increasing about 25% over the last few weeks. Online sales have been increasing 40%. We're seeing that people are also stocking up on their cannabis supplies. Since Missouri is now a medical cannabis state, but our neighboring state, of course, in Illinois, is a recreational cannabis state. I have not had the time to look up numbers on electronic cigarettes, but I would imagine that those have increased as well, because every time that market has gotten tightened with changes in flavoring and other such issues, those purchases have been increasing as well. Now, to make this story even a little grimmer, we know that we have not really addressed alcohol use disorder and tobacco use disorder in recent years because, as mentioned earlier, the opioid concerns are the ones that have been kind of leading the national conversation due to the immediacy of death and the fact that it's been an equal opportunity killer in terms of ages and in terms of geography. So next slide, please. We're going to take a look at, just as a reminder again, I always like to bring up some of the neurobiology and neurochemistry around addiction because I think it's important for us to remember that when we can look at this through a biological lens, it often takes away the moral failing argument that some people still can be obsessed about when we talk about addiction medicine. Typically, I focus on dopamine, the second in the row here of 7 major neurotransmitter systems, because that's the one that we're most concerned about when we talk about opioids. The reason that it's useful to talk about this and to bring us back to the chemistry here again is to realize when our nervous system is on edge because our neurotransmitters are messed up, if we suddenly have a cutoff from our supply of opioids, we're entering into a state where our neurotransmitters are not being regulated. We're not getting the normal dopamine push. As we often hear, dopamine is the neurotransmitter that we release when we hold a puppy, when life is good with the world, when we feel safe and secure. And if we're cutting off that supply because we're used to having opioids around, or we're using other substances such as amphetamines, methamphetamines, a sudden cessation in that supply is going to put our neurotransmitters and our chemistry on edge. We're going to try to find ways to soothe that chemistry to allow our brain to calm down again. And that's what I fear that we're seeing right now with we're going to see people changing over to other psychoactive substances to calm that. Next slide, please.
Yes, and Dr. Rutnick, I should have asked you this before. This is Stacy again. We are getting some questions in the chat box. Would you like to answer these as we go?
Oh, sure.
Until the end.
We can do as we go. That's fine.
Okay, great. So we did have one question. The article that you referenced about the increase in alcohol sales, somebody was wondering where that article was published.
Sure. If you Google The Conversation and probably just put in there alcohol sales, I think you'll come right to it.
Okay,
And if not, we can send that on to participants afterwards.
okay, great. So the publication is called The Conversation
Correct.
for clarity. Okay. And then the next question is, would the change in format shifting to online groups and programs such as AA impact part of this phenomenon? And if so, can we measure that?
Sure. The story actually on NPR before we started today at 11 o'clock was a switch to online formats for a lot of peer support and community support groups. It's interesting. Some people are finding more comfort in this and more intimacy than they expected because people are actually looking at people eye to eye if they're doing a Zoom or some kind of meeting like that. I don't think phone meetings are very positive overall, but with the video opportunities with Zoom and other formats, some people like that. Old people like me probably don't like it as much because it's not something we're typically used to. So that's something that we have to kind of see how that plays out. The other reason I really like that question is we're finding out at ARCA right now, as we're finding out around the state, as providers who have been able to transition into virtual office visits. I don't think we're ever going to go back to where we never have virtual office visits again. I think we're going to be adding this format to the types of therapeutic services we can provide. And hopefully our funders and our federal and state level funders will listen to us with the benefits that we're reaping with this kind of work. So I think we're at an interesting time here where that idea of necessity being the mother of invention, I think we're seeing different ways of delivering care that I do not expect to go away once we find our new normal after this pandemic. Okay, so keep those questions going.
Okay,
So,
thank you, Dr. Broderick.
certainly. So yeah, this next slide, just yesterday when I was putting this together, I did a Google search on alcohol and cannabis. On the left, those were top 3 that came up on liquor sales. And on the right, those are top 3 that came up with cannabis sales. So you can see this is something that could have long-term effects on us as individuals, but also in the situations in which we're confined. We mentioned earlier some folks who are at higher risk because of potential of disinhibition related to alcohol use, people that might see an increase in intimate partner violence, increase in or exacerbation of mental illness. This is also kind of a cauldron, and I bring it up today not to bring us all down, but for us to be thinking about how can we better serve our clients and our patients moving forward. So next slide, please. I found out, because I'm learning addiction medicine the hard way, I always say. Many of you who know me know that I came into this after doing homeless work for many years and then correctional health care for about over 15 years in my Clayton office at the jail and juvenile detention. So I'm learning kind of the formal world or the other avenues of addiction medicine now. And I'm learning that there's certain third rails, and one of those is cross addiction, whether or not it's a real thing. Well, I'm going to avoid the whole thing about whether or not it's a real thing and whether there's an addictive personality by saying we know that when we look at the chemistry of addiction, like we talked about a little while ago with the neurotransmitters, we do know that there are some things that protect us against addiction and serious mental illness, and there's some factors that create more vulnerabilities for us in terms of addiction. We know, for example, the more structured our lives are as children, the safer our environments are, the more security we have in terms of home and food and parenting. Those things are protective. We know that the more chaotic our life is as children growing up, the more exposure we have to violence, the more exposure we have to trauma. Those are things that put us at higher risk of vulnerability for both addiction and substance use disorders. And that's where now we're in situations where we want to take a look at what's going on at home, what's going on in our lives. Can we go back one slide just for a minute? Okay. And that's where, as we start looking at what's going on in our self-isolation, we have to be really careful about what are we adopting as soothing behaviors, right? We all need to have them. For me, it's my two cats keep me sane. And they are pouting right now in the closet because they're not Zoom bombing me. Other people, their kids are a source of comfort, at least for an hour or so. Other people have gone back to hobbies, gardening, getting out and walking the dog, um, reading. There's a lot of ways to develop self-soothing behaviors. Keep in mind, if people have a polysubstance use disorder or an untreated mental illness, these things can exacerbate if we allow people to isolate excessively, if boredom becomes a problem, and if our safety is challenged. So let's take a look at our next slide, please.
Yeah, and I think another question that we just got
Mhm.
that's right now, somebody asked, do you think that the term social distancing is causing more distress within the country and various communities due to novel term that is unfamiliar? Could this also be causing the increase in SUD? What if we call it physical distancing from the start to imply that we must physically distance ourselves, but social interactions, especially with use of technology, can still be done?
Yes, I think that's a great idea. And I see that on Facebook a lot. And especially for younger people that I think these words and phrases can be a little more loaded than for others. I think that is a good idea. And I think we're finding creative ways to establish that. One thing that I'm sure many of you have seen the movie Contagion. I have not. But I have been told that just about every term we're using in this epidemic was used in that movie from 8 years ago, including social distancing. But I do agree. If we talk about physical distancing, I think that is a gentler term that people might respond to better. Okay. So conversations. Pay attention to the behaviors of what's going on in your home. I know that might sound like kind of a dumb thing, but um, I was we're not used to spending this much waking time around most of our family members. So something I have learned a lot from parents in the last few years when we have more talks around addiction is there's a lot of signs that someone's not doing well emotionally, physically, or because they're using substances. Self-isolation is one that's very common. If we find out that, where especially with your teenagers, where are they spending their time? We all need alone time. We know that, but it's something that we kind of should kind of think about in terms of adding a new awareness to our time spent with others. Everybody loves to say, "Oh, I wish I had time to talk to my blank about blank." Okay, we got lots of time to do that now. We have time to have conversations that we usually have excuses for. My work wife at St. Louis U likes to say, busy is not an excuse. We make time for things that are important to us. Well, this is a really good reason to start normalizing conversations around emotional health and well-being, asking about risky use and risky behaviors. When I finish up here in a few minutes and our folks from NCADA come on, they'll talk about some very good programs they've developed about talking with young adults and adolescents about risky use and substance use. One of the other things I challenge people my age to do is tell stories about the relatives in the family that nobody talks about, or talks about that funny aunt or uncle who had a drinking problem or had substance use disorder. Or as I tell my students at St. Louis U, if nobody in your family ever had an addiction or ever was in jail or prison, then your parents are lying to you. So have those conversations, not to shame people, but to just normalize the fact that all families have challenges. All families go through experiences, have mental illness. All families in the United States have some kind of substance use disorder presence. So that idea of working that into as more of a casual conversation makes it much easier to bring up. Kind of like having the sex talk is with kids, right? The more comfortable that a caregiver is in talking about sex, the better questions you're going to get from a young person. Let's go on to our next slide. Treatment. There are treatment places are still open. Not as many as were before. Some places don't have the staff or the capability to do virtual care. I can tell you ARCA certainly is open. We're doing a lot of virtual treatment. Most of our federally qualified health centers in the area are doing virtual visits now. I know our residency program in family medicine at St. Louis U, our continuity clinic is at Family Care Health Center, so they're doing virtual clinics. Don't assume places are closed, just give them a call. The federal government as well as the state government has eased up funding restrictions, allowing us to do both face-to-face talk by video and by the internet, as well as telephone calls, and allowing those to be billable. That's incredibly helpful for us to be able to keep the doors open. So treatment is available in case there are family members or loved ones who need treatment at this time. This might be the opportunity to strike when the iron's hot. If people are having problems with an opioid habit, a drinking habit, or whatever habit, and having those conversations. So we really encourage people to seek treatment as soon as possible. And I have engaging in physical activity here because that is one part of every treatment plan when we talk about health that's important right now is find safe ways to be outside, to be walking, to be cycling, things that you can get your exercise in. I know we're going to have a lot of exhausted dogs who get walked 7 and 8 times a day now, but they'll get over it. That'll be fine. Let's take a look at our next slide, please. Under prevention, avoid boredom. I haven't had a boring day myself since I learned to read, but I know that doesn't always ring true for everyone. You can ask the Google about meaningful activities during COVID-19. Lots and lots of places are posting interesting activities from cooking to hobbies to you name it. And then mitigate risk at home. Reduce risk at home for family members, particularly if you're concerned that there might be challenges for some of the people you're living with. And this kind of falls under environmental prevention tools that we've known about for a long time that work at a community level. Well, think about doing that in your home. Really limit, make sure that you don't have extra pills in the medicine cabinet, that you don't have those leftover Vicodin that you were saving just in case. Or and take a look at liquor. If you're one of those people stocking up on liquor, lock it up, limit it. Same with tobacco, cannabis, a gummy's a gummy, right? So be very mindful of how you're storing and mitigating risk for people who using these who shouldn't be. Schedule activities, try to maintain a schedule. We all know that especially young people do really well with a schedule. And then the monitoring behaviors and isolation, we talked about that earlier. One of our community partners at Archway is Addiction is Real. And this is a St. Louis-based organization, again, grassroots, started by parents and families of people who have lost loved ones due to the opioid addiction. They have a virtual bedroom on their site, which includes red flags or areas things you might want to look at, that if you see these kind of things in a bedroom or in your child's life, carrying a backpack around all the time, even into the bathroom. There's a lot of behavioral things that they can kind of tip you off to. Again, not to make people paranoid, but these are strange times that we're in, and we want to be as safe as possible. Let's go on to the next slide, please. Some COVID-19 sensitive resources to take a look at. Of course, our hosts here at the NCADA are at the top of the list. Experts in prevention and connections with young people. At the Archway Institute, something that we do very well there is care of the caregiver. We connect a lot with families of individuals affected by substance use disorders. We have peer specialists and staff members who do a phenomenal job in answering the phone and talking to family members when they don't even know where to start a conversation. Mental Health America of Eastern Missouri, great site as well for those creative ideas of what to do when you're locked up with somebody that you're not used to spending that much time with. I have our contact information here at ARCA as one of the virtual addiction medicine programs in the area. And Missouri Department of Behavioral Health has done a nice job in pulling together multiple resources for providers, for clients, for families, for educators, and that's on their site as well. Next slide, please. Many of you on the call know about these resources, but I added it nonetheless. The National Survey on Drug Use and Health. Having problems sleeping at night, download that for free. Those pages and pages of tables and charts will put you right to sleep. But it's a very comprehensive overview of drug use and related health issues in the US, again, going on for decades. And then I have the NIAAA and NIDA. Both of these resources are excellent if you're looking at patient-friendly literature around addiction. This is very easy to read, very easy to understand. Stuff that young people as well as adults can read and prompt some very good questions. That's my part of the presentation for today. So if we have more questions now, or Stacy can just take it over with programs and resources at NCADA related to this topic.
Sure. I think I will give all of our attendees like maybe another 30 seconds to or minute to go ahead and submit their questions if they have them. We don't have any right now, but I'll go ahead and say thank you again for presenting on this very relevant topic. A lot of the feedback we're getting in the chat is really great. And of course, thank you for sharing NCADA as a resource and all these other incredible organizations that are really just rallying to make sure that we're able to do our jobs despite the challenges that we're seeing. So I don't have too much more to add about NCADA. Dr. Rotnick, do you mind if I go ahead and page forward again?
Oh, please do.
And here is, we should point out that this is Dr. Rotnick's email, but I think there's an extra T in there. Is that right?
Oh, you're right. There is an extra T in there.
Okay, so that is Dr. Rotnick's email address minus one T. There are two T's.
And also, I'm just putting in the chat box the online, the URL to that article that I mentioned earlier in the conversation.
Okay. Oh, and somebody did ask, could we get the name of the movie again? I think
Oh, Contagion.
Contagion. Yes.
I got to put that in there too.
Okay, great. Okay, so I will just wrap up talking a little bit about NCADA if there are folks tuning in who weren't familiar with what we do. But the service that we offer is substance use assessment. We are not a treatment facility, but we do have counselors available to provide assessment and referral. We know that everyone's situation with substances is different, so there are different treatments and resources that are appropriate based on those individual and unique situations. So we are very happy that we have been able to continue this service. We are not able to see clients in person, but if they call us, we are able to meet with them remotely. So I have our phone number in big, bold, red letters there if anybody is in need of those services. Another question that we might be able to help people with is routing them to low cost or no cost Narcan. That's something that may also be that people may be in need of at this time. So we really just wanted to say that that service is still up and available. Also, thank you, Dr. Rotnick, for mentioning our Talk About It campaign. If
Mhm.
people go to talkaboutitmo.com, MO as in the state of Missouri, talkaboutitmo.com, we have age appropriate talking kits on how to have the conversation about substances. It is really easy to access. You can even look at it on your phone. You know, this is not meant to be pages and pages of difficult and complex reading. These are just some really simple tips about how to start the conversation and what are some of the goals and things that you might want to accomplish in having those conversations. And again, they are age specific. So there's different kits. There's a pre-K through second grade, a third through fifth grade, 6th through 8th. We have a high school kit, and then we have an additional kit if you suspect a young person might already be misusing substances. So if that's a resource that you think could be helpful, please use it, please share it. And if you have any questions, of course, feel free to let us know at NCADA. So at this point, again, I want to thank all of our attendees for tuning in and for being so flexible as we work to quickly change this format. This really concludes our presentation. If you are someone who was interested in getting contact hours, that's the information I will be covering now. So you are welcome to sign off. And again, I will provide the information regarding those contact hours next. So thank you again to everyone, and thank you, Dr. Rotnick.
My pleasure. Thank you.
Okay, so it looks like I still have quite a few attendees with me, so I will just keep talking. And again, this is specifically on how to acquire contact hours. The screen that you have in front of you right now that you should be seeing is a screenshot of NCADA's website. So our website, I'm going to go ahead and type it into the chat box. It is ncada-stl.org. So if you go to our website, you will be taken to this homepage, and you will see a donate tab at the top of the page. Oh, you know what? I'm sorry. This is another screenshot. My apologies. I wanted to let everyone know that if you go to our website, if you go to our homepage, we also have some additional resources listed, and you can just click on that image that you see here on our homepage, and that's additional resources related to COVID. So I just wanted to let everyone know that that's there. And that's what this looks like, the virtual community resources. We have a list available there. Okay, so sorry, returning back to contact hours. If you are in need of contact hours, the way that you're going to pay for those is you're going to go to our website. This, again, is a screenshot of our homepage, the correct screenshot. Again, my apologies for that. If you look at the highlighted arrow and the highlighted donate tab, you are going to click there and you will be taken to a donation form. I'm sorry, that's just what it's called. I know the word donation is not the most appropriate right now, but it's what we were able to do on such short turnaround. And what you'll do is you will submit a donation, a payment, whatever you want to call that, a payment of $5. You will complete that form and submit it. And once you complete that form and hit the submit button, you will receive a receipt. And what you will do then in order to receive your certificate is you will forward that receipt to me. And I have provided my email here on this slide, as well as my cell phone number. So if you have any questions or you run into any trouble along the way, you can contact me via email, via phone, either is fine. But again, what you'll do is submit your payment of $5 at that donation form. And once you receive your receipt, you will forward that to me and I will work on getting you your certificate for contact hours. So again, any questions, please feel free to let me know. I will stay on the webinar here for just another few minutes in case anyone wants to send me questions via chat. But if you have all the information that you need and you feel confident in how to get your contact hours, again, thank you. Everyone stay safe, and we will see you next time. Thank you.